Prioridad para continuar con este plan debe revisarse cada 3 años. El IEP trienal.
Okay. Thank you, Karen. And as we are going through, please definitely drop your questions in the chat and I'll keep my eye on the chat so I can answer them.
Padres, si tienen alguna pregunta, lo pueden escribir en el chat.
Okay. So I have a question for everyone to please answer in the chat. What is the difference between an annual IEP and a triennial IEP?
Papás, ¿qué diferencia hay entre un IEP anual y un IEP de 3 años? Pueden escribirlo si gustan en el chat.
Just waiting to see if we get any responses in the chat. Okay. I see one answer that says an annual is to check progress, and then the try is to check if the student still qualifies for an IEP. And that is exactly right. So once a year, we have the meeting to check the progress, and then every 3 years to check to see if the student still qualifies. Okay.
Alguien puso anual, es para chequear progreso. El de 3 años es para ver si el estudiante todavía califica para un IEP.
So what is the process of getting an IEP? So a request for assessment must be submitted to the school. And then the school will provide an assessment plan to the parent. The parent must sign this plan to give consent to the school to begin testing. Once we receive a signed assessment plan, we then have 60 days to do all of the assessments for the student and then hold that initial meeting to see whether the student qualifies.
¿Cuál es el proceso para obtener un IEP? Debe presentarse una solicitud de evaluación a la escuela. La escuela proporcionará un plan de evaluación a los padres. Los padres deben firmar el plan para autorizar la realización de las pruebas. La escuela debe realizar las pruebas y celebrar la reunión inicial de IEP en un plazo de 60 días.
So I just talked about the process of like getting the assessment, but here are the eligibilities where a student would be able to qualify for an IEP. And there are 13 different eligibilities right now. The first one is autism. The next one is deaf and blindness. Third one is just deafness, emotional disturbance, hearing impairment, intellectual disabilities, multiple disabilities, which could be any combination of these 13 disabilities would fall under multiple disabilities. Orthopedic impairment, which is typically for things like cerebral palsy and other disabilities that affect a student's ability to stand, use their arms, legs. Other health impairment, which is most common for ADHD or ADD, but it can be things like heart conditions, Tourette's, or other physical impairments. Specific learning disability, this is one of the most common ones. This usually means that a student has a processing disability in auditory processing, it could be visual processing, and some things like dysgraphia, which is a processing disability with writing, or dyscalculia, which is a processing disability specifically with numbers. All of those could fall under what's known as SLD or specific learning disability. The next one would be speech or language impairment. The next one is TBI or traumatic brain injury. The last one is visual impairment. So any of these eligibilities are considered an identified disability, and a student can have an IEP if they qualify as having one of these.
Requisitos, idea completa de 13 requisitos. Número 1, autismo. 2, sordera. 3, perdón. 4, trastorno emocional. 5, deficiencia auditiva. 6, discapacidad intelectual. 7, discapacidades múltiples. 8, deficiente ortopédica. 9, otros problemas de salud. Un ejemplo, como si tienen un problema del corazón. 10, discapacidad específica de aprendizaje. Un ejemplo, algo visual. 11, define de habla o de lenguaje. 12, lesión cerebral traumática. Y 13, deficiencia visual.
All right. So what does an IEP consist of? So all of the parts that go into this individualized education plan are first, the identified disability. In order for the student to get the IEP, we have to know that they have an identified disability, which for schools is known as their eligibility. The next part of the IEP is their present levels. So we need to know their strengths, so what they're doing very, very well. And we need to know their areas of growth, what they really need help with. Every area in the IEP where a student has been assessed, we have a present level for. The next part of the IEP are the goals. So we set these goals for 1 year for what the student is able to achieve with support for 1 entire year. And they will have a goal area for every service that they have. The next part of the IEP is accommodations. So these are all the supports that the student needs to be able to access the curriculum and fully participate in school. The next part are the services. So these are the specific services that are going to be provided to the student to help them reach their goal. So for example, if the student qualifies as having a speech or language impairment, the service under that to target that need would be speech therapy. So they would receive maybe 30 minutes a week of speech therapy, depending on the need. A IEP could also include a behavior support plan for a student that has behavior needs, or something known as an individual transition plan. Typically, if the student is in high school, the IEP must include a transition plan to help the student transition to college or a career or independent living as an adult.
¿En qué consiste un IEP? Discapacidad identificada, elegibilidad. Niveles actuales, académico, socioemocional, conductual. Objetivos, lo que el niño necesita, apoyo para el año. Adaptaciones, apoyos que ayudan al alumno a alcanzar sus objetivos y a acceder al plan de estudios general. Servicios, lo que se proporciona para ayudar al alumno a alcanzar sus objetivos y acceder a la educación general, de habla, RSP, asociamiento. También podría incluir un plan de apoyo al comportamiento o plan de transición individual. El plan de transición usualmente es algo cuando ya el estudiante está en high school, en preparatoria.
All right. So for the services, what services are offered based on student need? So we do have a pretty wide variety of services that a student could be offered depending on the need. So we have RSP services for students that have academic needs, and these are typically provided for reading, writing, and math. So those core skills, those RSP services would be to help the students with those. Speech therapy for speech language needs, counseling known as DIS counseling for social emotional needs, and for behavior needs as well. Adapted PE, if a student is physically unable to participate in regular PE because they're not able to run, hold a ball, throw, walk, things like that, then they can be offered an adapted version of PE. Occupational therapy, if a student needs support with gripping, fine motor skills, handwriting, things like that. Also, there are two different levels of behavior services. BID, that's the first level of behavior services where the student has pretty high behavior needs that can't be met just with the teacher or the other staff that are there at the school. So we have a behavior therapist who will come give us strategies and build a support plan for that student. The second level, which is higher, is a BII, which is one adult who is actually with the student all day or most of the day to help implement the behavior treatment plan. And this is if the student's behavior is so severe and occurring so frequently that, again, the treatment plan and the classroom teacher isn't enough to target the behavior. VI services can be offered if a student has a visual impairment. These are things like magnification, um, large print textbooks, and other things that will make the materials accessible to the student's vision. And then the last service is DHH. So if a student does have a hearing impairment, DHH services can provide us with microphones and also different things to help a student be able to use their amplification devices if they do have like hearing aid.
Servicios. ¿Qué servicios se ofrecen en función de las necesidades de la IP? Servicios RSP para necesidades académicas, lectura, escritura y matemáticas. Servicios para el habla, para necesidades de habla o lenguaje. Asociamiento para las necesidades sociales y emocionales. Necesidades de comportamiento. El otro sería educación física adaptada si un estudiante no puede participar en PE. Terapia ocupacional si un estudiante necesita apoyo con agarrar, sostener habilidades motoras finas. El otro sería servicios de comportamiento si un estudiante tiene necesidades de comportamiento que no puede ser satisfechas por el profesor personal de aula. Un BI si el estudiante tiene necesidades de comportamiento muy altas que requieren un proveedor uno a uno para ayudar con la gestión del comportamiento. O el BI si un alumno tiene una discapacidad visual que requiere amplificación, materiales con letra grande. El DHH si un alumno tiene una discapacidad auditiva que requiere micrófonos e implantes.
Okay. So now I want to talk about LRE, which stands for the least restrictive environment. So the IEP team has to determine what's the appropriate placement and what are the appropriate supports for the students, but we have to think about the least restrictive environment. And what this means is that the student should be given the opportunity to be in the general education classroom with their gen ed peers as much as possible. So we have to put in a right amount of supports that don't pull the student outside of the classroom more than is absolutely necessary. And we have to make sure that we're providing the students with opportunities to socialize with peers and not pull the student out so they're away from peers. So that is why the majority of our services are what's known as push-in. So that means the providers are in the classroom with the students so they can stay in the gen ed setting but still be receiving services. Oh, Karen, you're on mute.
Sorry. Perdón. LR, entorno menos restrictivo. El equipo del IEP se encarga de la colocación y el apoyo adecuados para los alumnos. Debemos de considerar el entorno menos restrictivo. El estudiante no debe ser retirado de la clase si es capaz de progresar con los apoyos en clase. El estudiante solo debe ser retirado lo menos posible con el fin de no perder instrucción general, plan de estudios. Menos restrictivo significa que los estudiantes se mantienen en el mismo entorno y tienen las mismas oportunidades para la instrucción, socialización como sus compañeros. Proporcionamos empuje en el apoyo con el fin de tener a nuestros estudiantes en el LRE tanto como sea posible.
Okay. So some of the benefits of making sure that we are thinking about the least restrictive environment is one, the students don't miss the instruction from their teacher. They are able to socialize with and learn from their peers that are sitting right there with them. They get the right amount of rigor in their classes. So even though they may be struggling because they do have the disability, they're able to get that support and get closer to grade level by being in the classroom. And they're not separated from their peers, which could make them feel stigmatized or some sort of like shame or embarrassment and feel like they're different, which is something that we don't want. So we want to keep them in the gen ed setting. And then last, it also helps the students learn to advocate for themselves, say what they need help with, know what their supports and accommodations are, which will help prepare them for high school, for college, and for careers in the future.
Beneficios del LRE. Los alumnos no pierden clase de su profesor. Los alumnos pueden socializar con sus compañeros y aprender de ellos. Los alumnos reciben el rigor adecuado en su clase, lo que les permite progresar y alcanzar el nivel de su curso. No se separa a los alumnos de sus compañeros, lo que podría hacer que se sintieran estigmatizados o porque se les apartará de sus clases. Los alumnos aprenden a defenderse por sí mismos y a pedir el apoyo que necesitan en todos los entornos, lo que les prepara para la escuela secundaria, la universidad y la carrera profesional.
Okay. So now moving on to parents' rights. So this information is very important so that way you as a parent, maybe your child does have an IEP, or just for you to know what are your rights as a parent of a student with an IEP. So there are really 10 main rights that you have as a parent of a student with an IEP. The first right is to participate. So you are part of the IEP team. You should absolutely be saying what you think would be best for your child because you do know your child best, participating, giving input on the goals, on the services. So you definitely have the right to participate. The second one is to receive prior written notice. So this means that when the school is going to initiate any changes in services or refuse an assessment request, you have to be notified in writing before this action happens from the school. The third right is to consent. As parents, you have to give the school consent to do any assessments. No school is allowed to move forward with these assessments to assess a child for special education if the parents do not allow it. On the other side, you also have the right to refuse consent. So if the school is sends a request for assessment or like a plan for assessment and you do not want your child to be assessed, you also have the right to refuse consent. Another right around assessments is the right to be given a non-discriminatory assessment. So this means that the assessment given to your child needs to be the best assessment for your child. For example, if your child is very dominant in Spanish, and that is the language that they learn best in, that's the language that they're most fluent in, we would have an assessment that's in Spanish given to the child with a Spanish assessor. So that is one of the rights around assessments. Another right around assessments is the right to receive an independent educational assessment. So if you disagree with the assessment from the school service provider, you do have the right to request a different assessment to be another assessment to be done from an outside service provider. The rest of these rights are more so around different things with the IEP. You have the right to access records. So, at any time, if you would like to look at your child's records from their services, maybe their very first IEP, all of their IEPs, or any other information that's with their special education records, you have the right to look at those at any time. You also have the right to stay in the current program if there's a disagreement about placement. So if you don't agree with the placement that is being offered, your student can stay where they are until that like placement discussion is figured out. You have the right to receive mediation. So if there are some disputes or some disagreements that cannot be solved within the IEP meeting with the team members, you do have the right to receive outside mediation to help come to an agreement for the services or the placement of the student. And then the last one is around pretty like severe school discipline. So you have the right to be informed of school discipline and alternative placement if a suspension or something very serious like that is going to occur for a student that has an IEP.
Derechos de los padres. ¿Cuáles son mis derechos como padre de un alumno con un IEP? Número 1. Participar. Los padres forman parte del equipo del IEP. 2. Recibirán un PWN, notificación previa por escrito, cuando una escuela va a iniciar un cambio o rechaza una solicitud de evaluación. 3. A consentir. Los padres deben de dar su consentimiento antes de cualquier evaluación. 4. Negar el consentimiento. Los padres pueden negarse a que se realice evaluaciones. 5. Recibe una evaluación no discriminatoria. Las evaluaciones no deben de tener prejuicios culturales ni discriminatorias. Un ejemplo, si el lenguaje del estudiante es español, su evaluación se la pueden hacer en español. 6. Recibir una EEI, evaluación educativa independiente. Si un padre no está de acuerdo con la evaluación del proveedor de servicios, puede solicitar una EEI. 7. Acceder a los expedientes. Los padres pueden revisar y solicitar los expedientes educativos y del IEP. 8. Permanecer en el programa actual. Si hay un desacuerdo sobre la colocación, el estudiante puede permanecer en la colocación actual hasta que se llegue a una decisión. Recibe medicación. Si hay un desacuerdo sobre un IEP, los padres tienen derecho a medicación para resolver la disputa. 10. Se informó de la disciplina escolar y de la colocación alternativa. Los padres deben de ser informados de la disciplina, como la suspensión, y un IEP debe celebrarse si un estudiante es suspendido por 10 días para determinar si la colocación es apropiada.
Okay. So what is Xterra's program model like? And there are different program models for special education, but at Xterra we have what's known as RSP, or the Resource Specialist Program. So this means that our resource specialist teachers, they're supporting the students in the gen ed classroom along with instructional assistants and other service providers. So other service providers like speech therapist or behavior therapist may support in the classroom, or depending on that specific student's need, they may pull them out for a short time to deliver those services. For us at Xterra, RSP means that we are trying to use the most open environment or the least restrictive environment and make sure the students aren't pulled out beyond what is absolutely necessary. So if we can have the services happen in the classroom, then we'll have the services happen in the classroom.
Modelo de programa de Xterra, RSP, Programa de Especialistas de Recursos. Esto significa que nuestro RST, Resource Specialist Teachers, apoya a los estudiantes en el aula junto con asistentes de instrucción. Otros proveedores de servicios, APE, habla, pueden empujar en el aula o sacar a los estudiantes para sus servicios. También proporcionan el apoyo que los estudiantes necesitan. RSP significa que usamos LRE para asegurarnos de que los estudiantes no sean sacados más allá de lo absoluto necesario, porque no queremos que los estudiantes pierdan la instrucción en el aula o estar en un entorno separado si no es necesario.
Okay. No, no, cool. Okay. So, in closing, there are many ways to support students at Xterra. Special education is definitely one of the ways that we'll support a student that has an identified disability that needs access to the curriculum. Um, but just in general, for all students, we have literacy intervention, air reading, tutoring, all star tutoring, and ELD instruction. And these are interventions for all students. So I will pause here to see if we have any questions.
Ok, te voy a leerlo de español. Cierre. Hay muchas maneras de apoyar a los estudiantes de Xterra. Educación Especial es uno de nuestros programas para estudiantes con discapacidades que necesitan apoyo para acceder al plan de estudios, pero también tenemos intervención de alfabetización, tutoría con lectura, área, tutoría con todas las estrellas e instrucción ELD para apoyar a todos los estudiantes. ¿Tiene alguna pregunta, papás?
Okay. If we have any questions, we can put them in the chat. I am going to stop the recording for now.
Papás, si tienen alguna pregunta, lo pueden poner en el chat.
Stop sharing my screen.